Hi, I'm Alicia Uribe, and this is for the anatomy class. I'm going to be doing the week 3 bone video, the axial skeleton. So I will begin. Looking at the front of the skeleton, this is the frontal. This part down here is the parietal. Then you have back here is the occipital. Then we have the external, this little bump right here is the external occipital protuberance. Basically this is for, this is just superior to the foramen, right here, it's superior to the foramen magnum and is median protrusion. You can feel this like a knob-like, it's a projection just felt below most of the bulging part of your posterior skull. Next we have the temporal, right here, the temporal mandibular joint. Then right here is the mastoid process. You then have the styloid process, which is very kind of hard to see, but it is underneath this little thing right here is the styloid process. And then right in here we have the external acoustic meatus. And then right here we have the squamous suture. So basically the petrous part of the temporal bone, you wanted to know what structures are housed within the part of the temporal bone, which is the styloid process and the mastoid process. For the internal acoustic meatus, this internal auditory meatus provides passages through which the vestibulocular nerve, the facial nerve, and the labyrinthine artery, which is an internal artery branch of the basilar artery. It can pass from inside the skull to the structures of the inner ear and face. So right in here is the sphenoid, the sphenoid, which is the greater wing. And then we have the superior orbital fissure, which what passes through this opening is the superior and inferior division of the oculomotor nerve 3. You have the trochlear nerve, the lacrimal, frontal, and nasal ciliary branches of the ophthalmic. Abducens nerve, you have the superior and inferior divisions of ophthalmic vein. Inferior division also passes through the inferior orbital fissure. Sympathetic fibers from the cavernous plexus as well. So right in here is the lesser wing of the lesser wing, and then you have the greater wing, which is down here. And then you have the optical canal, which is right in here. So what passes through the optic canal is the central retinal vein. You have the ophthalmic artery, the optic nerve, and the sympathetic nerves. Right in here is the ethmoid bone. You have this middle part, it's the top bone, which is this whole thing is a cristagalli right here in the back. Right here on the side, usually it's a sponge-like, and this top bone is the cribriform plate. And right in here is the ethmoid bone. This is on the outside view. Oops, sorry. Right here is the outside view of the ethmoid bone. For the cristagalli, the function of the cristagalli, it's basically a medium ridge of the bone that projects from the cribriform plate of the ethmoid bone. It is where the falx cerebri attaches anteriorly to the skull. The olfactory bulb lies on either side of the crista galli on top of the cribriform plate. As far as the cribriform plate, the cranial nerves, arteries, veins, and other structures is what passes through the little holes. Okay, so right in here is the coronal suture. Then you turn it all the way to the back. Right here is the sagittal. Then you turn just a little bit, and right in here is the lambdoid. So this part right here is a lambdoid suture. Then you come right in here, and right in here is the squamous suture. Okay, so the maxilla is right in this area right here. And from here, from here to here is the alveolar process. You have the nasal bone. You have the vomer, which is right in here, and the inferior nasal concha, which is right in this side right here. And the zygomatic process, or zygomatic, is actually, turn this here, and it's right in here, this area. So the two bones that form the zygomatic arch is 1, the temporal process, and 2, the maxillary process. As far as what two bones form the bony nasal septum, it's the ethmoid bone, the vomer bone, and the maxilla bone. Inferior nasal concha. Inferior nasal concha is a bony structure by itself. It does sit on the ventricle bony plate known as a nasal septum, separating the nasal cavity into two bilateral and symmetrical anatomic caves. So right here is the mandibular. On the very end over here you have the mandibular angle. From here to here is the ramus of the mandible. Back here is the condylar process. Then, let's see if I can get this part. So right in here is the notch, the mandibular notch. Then you also have in there as well is the coronoid process as well. So looking at the vertebrae column, you have, there are 4 curves. The first curve is right here through here, which is the cervical vertebrae. Then from this one all the way down to this one is the thoracic vertebrae. Then you have from here to here, it is from here all the way down to here is the lumbar vertebrae, and right here is the sacrum. The sacrum. The primary vertebrae are the sacrum and the thoracic, which is right in here. So right in here is the thoracic, and the sacrum are both primary. Secondary is a lumbar and the cervical. For the cervical vertebrae, there are 7 vertebrae in the cervical. In the thoracic, there are 12. In the lumbar, there are 5. And then the sacral, there is 4 approximately. It's a tailbone. So right here is the spinous process. Then you have the transverse process, which is right here. You have the intervertebral foramen, which is right in here. And you have the intervertebral discs, which are shown right in here. This whole thing right here is a disc. So this is the sacrum. In the sacrum, there are 5 fused vertebrae. Then right here at the very bottom is the coccyx.